Millions of Americans may be leaving money on the table, and the scale of that problem is bigger than many people realize. According to the National Council on Aging, roughly $30 billion goes unclaimed every year, and the people most likely to miss out are not usually the rich or the powerful, because they often have attorneys, accountants, and lobbyists watching every available dollar. The people who need the help most are often the ones forced to figure out complicated systems like Social Security, Medicare, Medicaid, retirement benefits, disability benefits, spouse benefits, divorced spouse benefits, and survivor benefits without a personal team guiding them through the paperwork. That is where the larger issue begins, because these programs are supposed to help people, but in practical terms, they often do very little to make sure eligible people actually receive what they qualify for. Especially when the rules are confusing, the agencies are difficult to reach, and the internet is crowded with misinformation. Here's where it gets interesting. Misinformation around benefits has always existed online. But artificial intelligence has opened the door for even more people around the world to create videos aimed at retirees, seniors, disabled people, and families trying to understand government programs. One example that was sent in by a viewer appeared to feature a completely fake presenter, and the details were striking. The background had an American flag, a globe, a light, a chair similar to the original creator's chair, though in a different color, blue shirts similar to the ones he normally wears, and even a microphone setup with both a stand and a boom-style stand. The assessment was clear that this presenter was 100% AI generated, and the video itself used a thumbnail about major changes supposedly coming by April 17th. The problem was that the video ran for 17 minutes and, according to the source material, basically said nothing meaningful. Still, it had reached about 160,000 viewers, leaving many people anxious about supposed big changes, wondering whether they had to call Social Security, go to the Social Security Administration office, or take some urgent action when no such action was actually required. This is the kind of fear-driven content people can expect to see more often. And while strong warnings can be valid when they are grounded in real information, there is a major difference between sounding the alarm about a documented issue and using empty scare tactics to create confusion. One real issue that deserves repeated attention is the future of Social Security benefits, because reports from Social Security trustees and Congress have warned that if politicians continue failing to fix the system, everyone's Social Security check could be cut in about 81 more checks by roughly 23%. That is not presented as a scare tactic in the source material, but as a reality created by political inaction over the last 40 years. The argument is that this subject needs to keep being discussed until one of two things happens. Either the cut becomes unavoidable and takes effect, or enough action is taken to prevent the cut before it happens. Some people may be tired of hearing about it repeatedly, but the reason it keeps coming up is that for 4 decades, the problem has remained unresolved. Now notice this. The fake benefits ecosystem does not stop with one AI presenter. There are also misleading videos about stimulus checks, tariff rebates, a so-called Doge dividend, and claims that money from tariffs is supposedly going to be returned to people. The source material makes the point bluntly by asking who has actually received money from any of those promises, and the answer implied is that nobody is raising a hand. Another example is the cost of living adjustment, or COLA. The 2026 COLA figure referenced in the source material was 2.8%, and the warning was that the moment that number came out, someone would immediately start making videos speculating about the 2027 COLA. That is exactly what happened, according to a viewer who sent in a video showing someone had already begun talking about it. The key detail is that the next COLA is not known until September, so any confident discussion before then is premature and should be treated carefully. There is also another category of alarming videos claiming that Social Security is monitoring bank accounts, tracking overseas travel, and watching every financial move retirees make. The source material says that for the most part, this is 100% incorrect when applied to regular Social Security benefits. The important distinction is SSI, which stands for Supplemental Security Income. SSI is not the same as regular Social Security retirement. It is not paid from the Social Security Trust Fund, and it is not a retirement benefit. It is a welfare-based program administered by the Social Security Administration for people with low income and low resources who who are disabled or age 65 or older. Because SSI is welfare-based, people who receive it have reporting responsibilities. If they receive money, they must notify Social Security. If they travel overseas, they must also contact Social Security. Social Security has moved to be more proactive in this area, meaning that if a person wants SSI welfare benefits, the agency can require permission to check bank accounts from time to time to see whether the person has received money, such as money from a long-lost uncle. In addition, if an SSI recipient travels overseas on vacation for more than 30 days, the source material says benefits can be cut off, and that is described as a new point. But the same does not apply to everyone receiving regular Social Security retirement benefits, spouse benefits, divorced spouse benefits, surviving spouse benefits, or SSDI, which is Social Security Disability Insurance. For those beneficiaries, Social Security is not supposed to be looking at bank accounts or monitoring overseas travel, at least not legally or officially. The source adds uncertainty about what Doge boys may be doing nowadays, but the main point remains that the agency is not supposed to monitor those regular Social Security beneficiaries in that way. After clearing away those misleading claims, the focus shifts to practical questions from people trying to understand the rules. One question came from Monica, who said her husband turned 67 on December 29th and wants to retire after that date, and she wanted to know whether he can start retirement paperwork before his birthday or only after turning 67 to receive Social Security. The answer was that he can start about 3 or 4 months early, and that is fine if he wants to begin his benefits. If he is already receiving Medicare, the process should be much easier because he is already in the system. If he signed up for Medicare at age 65, whether for Part A, Part B, or only Part A, then turning on the money side of Social Security is usually very simple because the broader application process has already been completed. But a red flag was raised about why Monica was asking. If she was asking simply because she and her ex-husband have a good relationship and she wanted to help him, that would be fine. But if she was asking because she believed she could not start her own benefits until he started his benefits, then she may have lost money by waiting. This brings in a rule called independently entitled divorced spouse benefits, sometimes shortened in the source material as IEDs. The rule can matter when someone was married for at least 10 years, is collecting benefits on their own record, is at least 62 years old, and the ex-spouse is also at least 62. There is one additional condition for this specific independently entitled divorced spouse benefit. The divorce must have been final for at least 2 years. If the divorce has not been final for 2 years, then the ex-spouse has to file first. But if the divorce has been final for 2 years, the ex-spouse does not have to be receiving benefits in order for the divorced spouse to claim. The warning was that if someone has been sitting around for 1 year or 2 years waiting for an ex-spouse to start benefits before applying for divorced spouse benefits, that person may have missed money unnecessarily. The broader point is that if a person was married to someone for at least 10 years, has been divorced for 10 years, is filing for benefits on their own record, and the other person is at least 62, then the other person does not need to be receiving benefits. They also will not be told that the divorced spouse filed on their record, and the filing does not reduce or otherwise affect the ex-spouse's benefit, the ex-spouse's new spouse, or any new children. Another question asked why SSA/SSI stops when a spouse gets approved for SSDI, and the answer depends on whose benefits are involved. If the same person is receiving SSI and later gets approved for SSDI, and the SSDI amount is more than the monthly SSI amount of $994, then SSI stops because the maximum SSI amount referenced is $994. If instead one person in the household receives SSI and the other spouse begins receiving SSDI, that can also affect SSI because SSI is welfare-based and considers living arrangements and household income. If money starts coming into the household through the other spouse's SSDI, that income can count against the SSI recipient. The source explains this with a simple comparison. If someone is receiving SSI because they have low income and low resources, and then they marry a multimillionaire, it would not make sense for them to continue receiving SSI. SSDI is obviously not multi-millions of dollars, but the same income counting logic applies. Another person said they are turning 67 in October and asked when it would be best to file. The answer again began with Medicare. If the person has already filed for Medicare, turning on Social Security money is generally very easy, so filing 2 or 3 months before the desired start can make sense. But there was another important work-related point. Because this person is turning 67 during the year, and 67 is the full retirement age referenced in the discussion, the annual earnings test is different. Sometimes people delay Social Security because they are working and believe their benefits will be suspended due to earnings. For people under full retirement age, the lower earnings limit referenced is $24,180. But for someone reaching full retirement age in that year, the higher amount referenced is $65,160. Since the person turns 67 in October, the relevant earnings period runs from January through September, and during that time, the person can earn $65,160 before Social Security begins withholding benefits. If earnings exceed that amount before full retirement age, Social Security holds back $1 for every $3 over the limit. Once the person turns 67 in October, they can earn $1 billion a month, and it no longer matters for the earnings test, according to the wording and emphasis of the source material. That leads to a strategic consideration. If someone waits until exactly 67, they receive the full benefit amount. But if they file a few months early, the monthly benefit may be reduced slightly, maybe by $10, $20, $30, $40, $50, or another amount depending on the case, while also producing extra checks that would otherwise not be received. The example given was checks for April, May, June, July, August, and September, which would be 6 checks. If each check were $2,000, that would put $12,000 more in the person's pocket than they otherwise would have had. The monthly benefit could be reduced by some amount, but the person also has to weigh the value of receiving that lump of extra monthly payments. The source even notes that if the person called Social Security 1 or 2 months earlier to ask about benefits, that might count as a protective filing, which could possibly mean 7 checks or 8 checks rather than 6, depending on the situation. The conversation also highlights how strong the community is, because people in the audience help answer one another's questions when not every question can be reached directly. Then a video question asked whether a person could collect an ex-spouse's Social Security and their own Social Security at the same time, or whether they could collect the ex-spouse's benefit when they turn 62 in 1 year, delay their own benefit until 67 or 70, and then switch. The answer was no. A person has to file for benefits on their own record first. And then, if their full benefit amount is less than half of the other person's full benefit amount, they may be able to collect the difference. Once a person files, deemed filing applies, meaning they must file for the benefits they are eligible for. If the person has a current spouse who is receiving benefits, then the person must also file for eligible benefits on that spouse's record. In a divorced spouse situation, the ex-spouse generally has to be at least 62. There used to be strategies before 2015 involving file and suspend and similar approaches, but those are no longer available in this context. The only comparable switching strategy still discussed in the source material applies when the spouse or ex-spouse has died and the person is dealing with surviving spouse benefits. In that surviving spouse situation, a person may be able to file for survivor benefits and delay their own retirement benefit. But when the spouse or ex-spouse is living, that strategy does not work for regular spouse benefits. The discussion then shifts to a broader policy concern raised by Eric, who mentioned Medicare, Medicaid, programs like Meals on Wheels, CHIP, and other programs hanging in the balance, and urged people to register to vote in local and state elections. The source material notes that there are 36 governor elections this year and says states are going to face a very hard time, particularly with Medicaid, SNAP, and pretty much everything else. Medicare is described as a federal program, but Medicaid is a major state concern because states are expected to receive hundreds of billions of dollars less from the federal government. The argument presented is that this reduction is happening because more money is being directed to the rich and powerful, leaving regular people, poor people, disabled people, and children to face the consequences. The source connects this criticism to what it calls the One Big Beautiful Bill, describing it as a choice about where national resources were placed. It also pushes back on the claim that Medicaid cuts will simply remove undocumented immigrants or so-called illegals from the program. The source states that by definition, it is illegal for undocumented immigrants to receive Medicaid under the program rules, while also acknowledging that some states provided state-funded health insurance to undocumented people living in their state. The point is that politicians can use this issue as a misleading explanation, and the source says a cheat sheet is being prepared to help people respond when politicians offer such claims. That cheat sheet is said to be planned for another website and then for placement in a YouTube description or comment area. It is supposed to include checklists for retirement, disability, Medicare, Medicaid, spouse benefits, and surviving spouse benefits, as well as a separate cheat sheet covering common myths. The idea is that when someone calls politicians, governors, or other officials and hears a misleading claim, they can look at the cheat sheet, identify it as a specific myth, and respond with the correct information instead of being brushed aside. The message running through all of this is that people need accurate guidance because the benefit system is difficult enough without fake AI videos, premature COLA speculation, false claims about stimulus payments or tariff rebates, and confusion about what Social Security can and cannot monitor. The most important takeaway is that regular retirement benefits, SSDI, spouse benefits, divorced spouse benefits, and survivor benefits have different rules from SSI, and misunderstanding that difference can create unnecessary fear. People who may qualify for divorced spouse benefits should not assume an ex-spouse has to file first if the marriage lasted at least 10 years, the divorce has been final at least 2 years, both people meet the age rules, and the person is filing on their own record. People approaching full retirement age should understand the timing of filing, the earnings limits of $24,480 and $65,160, the withholding rule of $1 for every $3 over the limit before full retirement age in the applicable year, and the possibility that filing a few months earlier may trade a small monthly reduction for several checks that can add up significantly. People receiving SSI need to remember that SSI is needs-based, counts income and resources, and can be affected by SSDI approval, a spouse's income, bank account verification, and overseas travel for more than 30 days. People receiving regular Social Security should not panic over claims that the agency is officially monitoring their bank accounts or overseas travel in the same way. And everyone watching benefit-related content online should be cautious, because a video can look polished, sound urgent, and attract 160,000 views while still offering very little real information. What stands out is that the real danger is not only a complicated benefit system. It is a complicated benefit system surrounded by fear, confusion, and content designed to exploit people who are trying to protect their income. That is why careful questions, reliable explanations, and a clear understanding of the rules matter so much, especially when billions of dollars go unclaimed, millions of people are trying to make retirement decisions, and the future of Social Security still faces a possible 23% cut in about 81 more checks if leaders continue avoiding the work of fixing the system.